People should be aware of suicide so that we can learn how to recognize and avoid them. Suicide is becoming one of the major causes of death now than it was 30 years ago. Suicide is the leading cause of death for teenagers and people older than 35. Each year in the United States, thousands of teenagers commit suicide. People who commit suicide usually do it because they feel they are a failure or they are hopeless. Some people feel the media should not report suicides, while others feel that society needs to be made aware of the serious issue. I think that society should be aware of the serious issue, but some people are killing themselves and others for the attention. Suicide is not as newsworthy as homicide. A person's disaffection with his or her own life is a less threatening than his rage to destroy others. Suicide is when someone takes their own life. About 1 million people commit suicide each year throughout the world. Mental health professionals do not have an indisputable duty to prevent their patients from killing themselves. They only the only suicides they must stop are those who that are impulsive. If a mental health professional deems a patient to have a national basis for wanting to die, the professional's primary duty shifts from preventing the suicide to ensuring the patient thinks through his or her decision carefully. The stress factors such as financial difficulties or relationship problems often play a role in suicide. Efforts to prevent suicide include limiting access to firearms, treating mental illness, and drug issues. Worldwide, there are more deaths due to suicides than to accidents, homicides, and war combat. Every day, approximately 95 Americans take their own life, and 2,370 more attempt to do so. Over 34,000 people in the United States did die by suicide every year. Alcoholism is a factor in about 30% of all suicide deaths. Firearms are the most frequent method of suicide among adults in the U.S. There are four male suicides for every female suicide, but three female attempts for each male attempt. Suicide is a major public health problem in the United States and a tragedy for all involved family, friends, neighbors, colleagues, and communities. In 2008, suicide was identified as the 10th leading cause of death in the United States. Individuals who die from suicide, however, represent a fraction of those who consider or attempt suicide. In researches suggest that there may be between 8 and 25 attempts suicides for every suicide death. Suicide is a public health concern that transcends states and regional borders. Research has shown that reported prevalence of serious suicidal thought, suicidal planning, and suicide attempts vary across the states and across areas within states. Preventing suicide and addressing the health care needs if a person's at risk. The suicidal behavior required the public health information sharing efforts that show and explain the effective preventive interventions exist. People who talk about committing suicide or make attempts to do not necessarily want to die. Often they are reaching out for help. Sometimes a suicide attempt becomes the turning point in a person's life. If there is enough support to help him or her make necessary changes, highlighting the prevalence of suicidal thoughts, plans, and attempts in metro areas may help federal, state, and local police policymakers continue to plan for the all for all resources to reduce the stigma associated with mental and conditional problems and mental health treatment. Blame is a comfort because a situation when someone or something can be blamed is a situation that could have been avoided, so could also be prevented next time. Many adolescents experience self-hatred. Adolescents experience self-hatred. Some express their insecurity destructively towards others. They are needlessly sharp with their parents. They drink and drive, and regardless of what peril they may pose to others, they treat peers with gratuity. This chain, this The more profound their self-hatred, the more likely it is to be manifest in extremely focused aggression. Warning labels meant to protect young people might be doing them more harm than good. According to nationwide Children's Hospital study on antidepressants and youth suicide rates, the study finds that suicides of Americans under 20 years old rose 18% between 2003 and 2004, the largest single year increase in more than 15 years. Public warnings that antidepressants might trigger suicidal thoughts and behaviors short of actual suicide in young people ages 20 and under who use them through suicidally usually abated after the first few months of treatment. Alerted consumers to a possible antidepressant suicidal link in June 2003 when tests showed increased risk in young consumers of the antidepressants. Each year in the United States, thousands of teenagers commit suicide. Mental health experts believe that young people may make vulnerable or maybe more vulnerable thoughts of suicide than adults because they do not understand that death is final. They may be looking for a way to end their problems and do not realize they will also be ending their very existence. Some of the factors that have contributed to the increase of suicidal behavior among teens in the past 30 years include excessive exposure to violence in the media, easy access to handguns, lack of availability of mental health services, a high divorce rate among their parents, abuse, and general sense of isolation. Nearly one in every high school student, or every 6 high school student, have seriously considered committing suicide, and 1 in 12 students have attempted suicides. Studies show that there's more female teens than male teens consider suicide. The suicide rate highest among Hispanic females and lowest among the white males. Students struggle with suicide more during the first few years of high school than the last few. More teen suicides are reported as a result of bullying. Overall, the suicide rate among teens has climbed in the past few years from 6.3% in 2009 to 7.8% in 2011. Teenagers experience strong feelings for stress, confusion, self-doubt, pressure to succeed, financial uncertainty, and other fears while growing up. Depression and suicidal feelings are treatable mental disorders. The term assisted suicide to the practice of physicians prescribing legal drugs that allow terminally ill patients to end their own lives. The difference between assisted suicide and enthusiast is the assisted suicide. The doctor may only provide the drugs, not administer them, while the enthusiasm the doctor can provide and administer the drugs. People should be aware of suicide so that they can learn to recognize and avoid them. Suicide is becoming one of the leading causes of death among Americans. People should know that they're happening so that we can prevent them as much as possible, but we should not let them be in the news just for attention. People who are depressed should seek help. We need to help people that are in serious need of it so we can prevent suicide as much as possible.